A looming crisis, the impact of H.R.1 on California's safety net. In the heart of California, a silent alarm is ringing, signaling a potential crisis for the state's most vulnerable residents. As counties grapple with the implementation of H.R.1, a controversial piece of legislation, the consequences for Medi-Cal and CalFresh programs are far-reaching and alarming. But here's where it gets controversial. The changes mandated by H.R.1 could leave countless families without access to essential services. The California State Association of Counties, CSAC, is sounding the alarm, urging collaboration to prevent a devastating impact on the state's safety net. Cuts to Medi-Cal and CalFresh will create a perfect storm, warns John Gioia, supervisor of Contra Costa County. Fewer people will have access to healthcare and food, and the strain on our emergency rooms will be immense. We're looking at a scenario worse than the Great Recession. H.R.1 introduces stricter work requirements for CalFresh and Medi-Cal, making it harder for families to qualify. It also increases the frequency and complexity of eligibility checks, a move that could overwhelm counties with additional administrative burdens. And this is the part most people miss. The federal government is reducing its contributions for program administration and emergency services. Counties, already stretched thin, will have to bear the brunt of these cuts. The increased workload alone could cost counties hundreds of millions of dollars annually, CSAC's letter states. Without additional resources, we'll have no choice but to cut programs and services across the board. The impact on communities will be severe. Residents can expect reduced clinic hours, longer wait times, and delayed or lost healthcare coverage. Emergency rooms will become even more crowded, leading to delayed diagnoses and poorer health outcomes. In rural areas, the situation is even more dire. The social safety net is already fragile, says Jeff Griffiths, supervisor of Inyo County and president of CSAC. These cuts could be the final straw, pushing our healthcare system over the edge. As California's 58 counties navigate this challenging landscape, the question remains, how can we ensure that our most vulnerable residents receive the support they need? Join the conversation and share your thoughts on this critical issue.